Hello and welcome to the Week in Review live on NTN. Today is Saturday, the 17th of October 2020, and we are coming off of a whirlwind week, I would say. I'm joined, by the way, in studio by Lucia Joseph. The two of us will be presenting to you this morning, and just fitting that we come off of the sabbatical of a week in review to come back and to bring you these important updates in this past week. Good morning, Lisa.
Hi, morning, Jesse. Good morning to our viewers. And yes, we're back. So the weekend wrap-up is back. And we'll be seeing the entire gang back shortly, I would imagine.
Fingers crossed.
Yes, fingers crossed. But Jesse, you're right. It has been, you used the word whirlwind, and yes, because we've had just sweeping changes taking place virtually overnight. And we would have heard from the chief medical officer the 33rd case being recorded, and that is at the Cassius Comprehensive Secondary School. So we know we had the student there who tested positive, a 14-year-old male, and now we know that a 62-year-old, the supporting staff, is also a positive. We'll be hearing from the chief medical officer just a little later on as we get into the broadcast.
But just to give you some information, before we hear from Dr. Bilmar George, information about this latest case of COVID-19 here on island, referring to the press release that we received from the Ministry of Health and Wellness last night, case number 33. The Ministry of Health received confirmation of another case of COVID-19, bringing the number of confirmed cases to date to 33. The individual is a 62-year-old female who works at the educational institution which case number 32 attends, that is the student. This individual presented with respiratory signs and symptoms and was tested for COVID-19 and placed in isolation awaiting results. Upon receiving confirmation of this case, arrangements were made for her transfer to the respiratory hospital for care. And just to let you know, if you're just joining us, a special good morning to you. We are live on NTN. This is not a recording. We are live on NTN this morning, bringing back a week in review, especially this weekend, as this past week has been very eventful, a hairpin bend, I dare say, in this trip that we've been on regarding this pandemic. This is case number 33, recorded last night, and we've so far recorded 5 new cases ever since this minibus driver, the case number 28. So
29.
Far, yes, case number 29, my bad. We've recorded 5 new cases. So by all indication, there has been some degree of community spread, and we do hope that everyone is playing their part. I mean, things are getting real. You know, we're not dealing with imported cases where these matters can be intercepted at the borders, at the airport, where there is stringent testing and assessment being made. We just saw last week that, you know, the Royal St. Lucia Police Force confirmed that 6 individuals had been detained on suspicion of trying to enter St. Lucia illegally. And so there is definitely cause for concern. We've seen with the cases, the minibus driver, we've seen that there is transmission. And from the school teacher, from the family, the student, the individual at the institution, there is some degree and a reason to be concerned, and we hope that persons are doing their part. We got a really urgent appeal from the Prime Minister on Sunday night on word of the case of the minibus operator, for persons to play their part, because so much work has been put into ensuring that we can mitigate all risks here on the ground within the population at this time.
I'd like to say, Jesse, this is not a drill. It is not a drill. And so the Prime Minister, again, was very passionate. Yesterday, there was the holding of the National Emergency Management Advisory Council meeting, that's NEMAC. And so you had representatives, singular representatives of these various organizations because of social distancing. And so but the Prime Minister was very firm that while he does not ascribe to trying to trample on the rights of citizens, but it is important that the enforcement takes place. And so there will be no tolerance for individuals who do not adhere to the established protocols. And that's important because we've been told time and time again that the social distancing, the wearing of the mask, as we are doing this morning, though we are more than the quadruple the 6 feet apart, but we are also wearing the mask, and so are our technicians here in studio. The other thing is, we heard from very early on with case 29 that this whole thing is just a hoax. It's this conspiracy. And even I'm still hearing individuals doubting with the 4 follow-up cases. They're still doubting in some aspects of the public's mind. Some may say, but it's convenient. I heard that about the 6 individuals that the police intercepted at sea. And I would like to say that often we do not know what the police have to go through in order to keep us safe. I was very happy that the police decided, listen, let us now allow the public to see exactly what it is that's really going on out there. Because there have been many other operations, missions, interceptions over the past few months, but the police, it's not publicized, it's not reported. And so if you can only know what you know. So it was good that the police force decided that at this time, in order for people to understand the severity of what is going on and all of the factors that are at play, because we cannot erase from the equation the sort of illegal entry into St. Lucia, that backdoor activity that's taking place. That cannot be left out of the equation with regards to what's happening to us right now and community spread. So I don't want to concretely say it is evidence that this is the source of community spread. That is best left for the experts to do that. However, it is part of that equation.
Absolutely. And, we continue to appeal to the general public to adhere to the protocols, hearing from the police that they will not be, tolerating non-compliance. And going back to the COVID prevention and control bill, for the protection. We're getting reports. Okay, at this point in time, we do have the call from the Chief Medical Officer, Dr. Sharon Belmar-George. We believe she's on the line right now. Good morning to you, Dr. Belmar-George.
Good morning.
Thank you so much for giving us this bit of time from what I know is a very busy schedule for you. We do appreciate it. If we could just speak to us about the latest case that was recorded, confirmed last night, as well as you coming off of the NEMAC meeting yesterday.
Yes, our latest case is an employee at the secondary school, which we've begun the investigations and the contact tracing from last night. In relation to this last case and the other 2 cases, we are doing assessments and reviews at the Cashews Comprehensive Secondary School today, and also testing from that site. So we have requested that anyone who may have been in contact or has concerns can also come in there. Could be teachers, could be students, etc. They can come in to get tested today. We've been there from this morning and we'll be there for the day. We've also been doing community reviews, both in the Olio area and also in the Deriso area. We were able to do between, I think Thursday we had up to 65 tests, and yesterday over 100 persons were tested, with I think over 200 screened. We also have interventions in the Deriso area. So we're trying as much as possible to assess and review all of the possible contacts and to test in a timely manner to try to reduce any possible impact if we could get all of the cases in a timely manner. The NEMAC meeting provided an opportunity for multi-sectoral discussion and a review of where we are now, because as I indicated yesterday, we're at a very critical point in the outbreak where those last 4 cases that we've noted without a travel history And for one of them, without a direct link, there's a level of risk for community spread. So our actions right now is really going to determine how wide we develop an outbreak within our community. So it allowed for multiple groups to assess the situation and also to provide feedback as to what some of the recommendations moving forward would be. And on Monday, Cabinet will make definitive decisions and indicate to the public exactly where we're moving forward in an effort to contain and manage our present situation. I want to make a special appeal to everyone for personal responsibility. We are responsible for ourselves and our family. Let us not lose focus on where we are. We're trying to protect our family, our friends from getting this, and we need to do what is responsible. So I'm asking everyone to ensure the regular hand washing. We've been saying it, I think everybody has heard it about 1,000 times. Use of hand sanitizer, wash your hands, avoid crowded areas, and the use of masks has been proven to be an effective measure to reduce transmission of respiratory illnesses. So the use of the mask and avoid large crowds as much as possible. Each and every one of us, we need to take that responsibility to protect each other. Yes, go ahead.
You spoke on the secondary school concerns with the latest cases, and also gave us an update with respect to the contact tracing efforts happening in Olio with respect to case number 29. But can you also speak to give us an update on the minibus operators that have so far been tested?
I don't have the exact number right now because when we got those results last week, from the weekend we extended the opening hours of our respiratory clinics, and we've through the National Council for Public Transport, we have been facilitating the testing of all of them, and we continued into the week. So we covered most of them. I don't have the exact number, unfortunately. I can get that for you at a later date. We were able to test the majority of them, and their results so far have come back negative, thankfully.
Okay. CMO, is patient 29, is he now cooperating in terms of the administration of his medication? Is he taking his meds right now?
I know there was some level of difficulty, but I don't want to discuss too much of his management for ethical reasons. But we've been having some reduced cooperation with him while in care. I think that's the most I'll probably say.
Okay, and also people are wondering and perhaps this will better enable us to understand how the virus moves and how infection is so easily taking place. Case number 30 and 31, the couple, have we been able to trace whether there's been any sort of link back to the Castries V4 route?
We have been able to link these two, the couple, to case 29 and to the circumstances of case 29. When we have the definitive results, we will update the nation on this later on. But at this point, I don't want to say any more, but we have been able to establish a link for those two.
Dr. Belmar George, compliance is becoming, as we've seen with case number 29, becoming of greater importance more than ever, even within the health system, with the concerns of that individual being compliant while receiving treatment. Can you speak to the powers that are afforded to your office with respect to ensuring that our population is protected, in ensuring compliance even after somebody is confirmed diagnosed with COVID-19?
Yes, through the Public Health Act and also the Quarantine Act and the new bill, which allows a wider coverage specific to the new protocols that we need enforced for COVID. For diseases of public health concern, that is, they pose where one person's individual behavior has the capacity to affect the general public. It gives us it gives my office, increased power to put measures in place to contain. And I mean, it definitely has to be in relation to the possibility of spreading a disease. So if it poses a risk to the public, there are lots of measures through the enforcement of the Royal St. Lucia Police Force to contain that, to isolate that person, and to do whatever is necessary. If you need to go into someone's household without their permission to get them, to isolate them, to get them into care, it allows that. And clearly, this will only be done with a justification for the protection of health and safety.
I know we have to move on quickly to dengue, but before we do, I just want to go on the way persons can get some more information if they are concerned. Certainly this situation with the comprehensive secondary school would be, concerning for parents or a wider cross-section of our population. Can you just speak to how persons can get more information? I know you mentioned testing earlier.
Yes, through the 311 hotline, you can call in to get updated information on what we're doing, because the situation is very fluid. And based on the numbers coming, we sometimes have to extend, put in new clinics where persons can access care. So via the 311, I just want to clear up a few other things. There's a lot of rumors going around. The persons who are put in isolation are those that were direct contacts of the case. We are hearing coming, a bulletin went out today. It was a post, it was something which is being shared saying that the Ministry of Health has asked parents of students to stay home. This is false. We have not asked parents to stay from work because their child was at the school. So we really want to ensure that you use credible sources for the information that you get. We understand that there's a level of anxiety out there, but we ask persons to ensure your information is coming from a credible source. And our offices are not open today, but 311 is open on the weekend where you can call and get updated information.
But I think, CMO, part of the anxiety is that you just don't know. And so speak to us about the sort of the safety factor. Is it okay that if I had a student, a child as a student at the school, that it doesn't automatically mean that there is positivity coming into my home, so that my child isn't positive and now I am perhaps positive? I think for a number of the people, that is the crux of the matter.
But Lisa, also, if just to interject here, there was the case made earlier, concerns about individuals who perhaps tested for COVID-19,
yes,
but their partner that they've been sleeping in bed with does not have COVID-19.
But I think the point is that you still just don't know.
Don't know. Mm-hmm.
Yes, we would still, for a positive case, we do a risk assessment. And based on that, we determine who needs to be tested, who needs to be quarantined, who needs to be isolated. And what we're noticing, if you've been asked to stay home or you've been quarantined until you get your results, we really want for people to stay home. But it's becoming to be a long level where somebody knows somebody who knows somebody, or this is a parent who's not a direct contact. At this point, it is the direct contact of who we're asking to stay in quarantine. And it has to be a scientific method and not a level of anxiety and panic to make that judgment.
Okay. And so, CMO, just on the others, some more the science side, just to reinforce or reiterate for us the methods of infection, if you want to call it that, because there's still thought that perhaps from perspiration or sweat you can contract COVID. Maybe the person just looks at you, and because it's airborne, it could get into your eyes. Can you help us clarify some of those for us?
Okay, it's a respiratory illness, and it is the most infectious time is when the person has signs and symptoms through coughing and sneezing. The droplets of the droplets would hold the virus, and then it gets into your nose, it gets into your mouth, and that is how the virus is transmitted. We don't at this point have evidence to say that it is impossible to spread if the person has no symptoms, but this has not been shown to be the main route of transmission. Now, because it's a virus that can survive varying lengths of time on surfaces, when you touch a surface where someone who may have had a cough or a sneeze touches, and then you touch your face, you can then infect yourself with the virus, and hence the importance of regular hand washing and disinfection of various surfaces. So to keep yourself safe, the infection prevention control measures that we speak about, where you disinfect and clean your surfaces regularly, you wash your hands regularly as well. And the use of the face mask has been shown to be extremely effective in preventing you getting the disease and then you spreading it around.
Dr. Belmar George?
Hello?
Okay. Yes. The final question on the COVID. We got a press statement from the Ministry of Education. Castries Comprehensive Secondary School closed for 2 weeks. All other schools closed for 1 week. Can you just reinforce the point of these closures? I know you being consulted on that matter. Not an opportunity for our teens and our students who are out of school to come to town, to socialize, to meet in groups.
Right. This is an important time when we really want to reduce transmission and we want to reduce the social gathering. So it's not a time for liming. It's not a time to go and plan a beach party because you're not at school. We want to limit those activities. And we realize the huge mental health impact of lockdowns and shutting. So that is why a lot of it we're saying, stick to your family unit. You can go to the beach, but go with your family unit. Don't have a beach party where you have people from all over the island mixing and intermingling. If you're doing a boat ride, let it be a small boat ride. If you're small social groups, your family groups, and not the general public all mixing up together. So for the students who have been asked to stay home as much as possible, try to keep them home and in a safe environment. And it's not a time where they group up and gang up in different areas. We want as much as possible to cut whatever transmission that may be out there at this time.
Our dengue status here in St. Lucia, Doctor.
Hello?
Our dengue status now here in St.
Yes,
Lucia.
the national epidemiologist in her report yesterday, she indicated that our numbers are still increasing and we're noticing increased mosquito indices in all of our communities at this point. And we've also noted up to 3 dengue fever deaths, and we're investigating a 4th one. So we really want to appeal to the public to do the reviews around your home to reduce the possible breeding grounds for the mosquito. It's a domestic mosquito, so it breeds in clear water in and around your home. And this is the main activity that you can do to reduce mosquito breeding and mosquito indices. Our clinics, our community clinics remain open for anyone who has any concerns. If you're not feeling well, go in and get reviewed by a healthcare professional.
Okay. Lisa, any questions on that?
Yes, and certainly for individuals not to stay home when they feel that they are getting worse.
Yes, that is important that they seek care at one of our wellness centers. Sorry.
Okay, thank you very much for your time. I know that you're heading out, but the new rapid antigen tests, Lisa, certainly could transform COVID-19 response here in St. Lucia and the wider Caribbean.
I am certainly very excited about that prospect, Dr. George. You've been briefed by PAHO. St. Lucia is going to be on board with the new antigen test?
Once the test becomes available to us, we have been looking for a test that is accurate and a lot faster. St. Lucia will be on board.
Wonderful. Thank you so much for that, Dr. Belmar George there. Thank you for taking the time off.
Thank you.
Okay. And so, Jesse, we can definitely say that the Ministry of Health is being very, very proactive. And we did hear the CMO indicate that there are persons directly related to the Castries Comprehensive Secondary School that contact tracing, the facilitation for tests, for assessments, so people can go in as of today for them to be able to get that sort of testing and assessment done.
Absolutely. Do stay tuned. We're due for a break at this point in time. When we come back, we take a look at the week that was, leading with this NEMAC meeting that was held yesterday. We did hear from Dr. Belmar George that we will be hearing an update as to the way forward from Cabinet shortly in a few days. So do stay tuned for a look back at that meeting, as well as the lead stories this past week.
Cette lisi ka registre vers min corona. Ek I ka fait mouvement ek an chay vitesse tan, chaque canef ka kouye pour vigilance publique là, fait wolou. Parler en place publique, qu'on bol en main, base, ti boutique, changer, distance sociale, 6 pieds, rodion à l'autre. I ka travail tan, si ou senti ko pas cordial, quarantine ko, pas en contact et puis l'autre, en cas où te toi pe exposé. Si on est couillé, Free 11 ou ben n'importe clinique yo pou. Les pays a dimi à clé, ça veut dire les supermarkets, pharmacies et puis ATM, yo accessible avant cette souhait. Pays à clé en plein, ça veut dire tout bagay fermé à 24 heures. Servi protocole comme sorti par bureau indication santé. Nous tout ensemble, ça sauve vermine corona. Si nous tous servi Jidla à toutes les.
Together let us win this war. Say to shall be a soldier. Together we can beat this corona.
Thank you so much for staying tuned. Today is Saturday, the 17th of October 2020, and we've just come around a very eventful weekend in this COVID-19 fight. We've seen so far 5 new cases, starting with the minibus operator and the chief medical officer. We just got off the phone with her before our last break. And she did indicate that there was a connection between the minibus operator and the later cases. So please take note, St. Lucia records
at least with the couple.
At least with the couple, yes.
And after that, we got the son.
The connection between the secondary schools. So please take note of that. St. Lucia last night recorded case number 33 of COVID-19 here in St. Lucia. We're going to go over the lead stories coming out of the government of St. Lucia as it pertains to COVID-19, our dengue situation. We're hearing from the chief medical officer. We just heard from her giving us a status update on that. And also other efforts on the part of the government to help keep St. Lucians afloat at this time when many persons are still struggling, many persons are still, they have not yet returned to work, and so assistance is being provided to them. And also we've gotten word, we saw this week a ceremony, a check presentation ceremony in the community of Ancillary for infrastructural upgrades for that community, the village tourism project happening in that community. But to start off with the NEMAC meeting, by the way, you can see that we both have face masks in studio, using, as usual, the copious amounts of hand sanitizer in this studio. And this is because things have taken a new turn. We have
this is not a drill.
Careful. This is not a drill. St. Lucia, it's not a drill.
It's not a drill.
Lisa and I don't live in the same home. We need to be extra careful at this point in time. If you are heading out, please ensure that you, if you can, carry hand sanitizer with you. If you can wash your hands wherever you're going, if you're at home, if you're at the office today, please ensure that you stay as protected as possible from COVID-19, amongst many the cocktail of other viruses that exists in our atmosphere, but most importantly, COVID-19.
Before we get into the NEMAC report, I just want to say good morning to Dawn Marie McDonald. Thank you so much, Dawn Marie. It's good to know that you are following the events in St. Lucia quite closely, and I'm looking forward to being able to say hello to you every Saturday from henceforth.
Nice, yes. Perfectly. I just want to welcome also everyone in general, because we know that we have a considerable number of individuals watching this morning. We did not promote this morning's program, the return of...
It really was off the cuff, as with anything else. As fluid as the COVID situation is, this is as fluid as we work.
So thank you so much for tuning in. We know that there are many persons concerned. Our kids are involved, especially, you know, things get serious when we come to our elders and our kids. So we do hope, we do appreciate you tuning in to get the latest updates. If you're on the go this morning, you can follow us on Facebook Live on your phone or our YouTube channel. If you're watching at home, 122 is the cable channel to watch NTN Live. On Friday, that was yesterday, October 16th, 2020, the Ministry of Health received confirmation of another case. That was case at number 32 of COVID-19. That was the 14-year-old male, the son of the recently diagnosed cases 30 and 31 from Castries. And we saw that Given this new case, we had the Chief Medical Officer, Dr. Sharon Belmar George, saying that necessary discussions were underway with the Ministry of Education and the management of the school. The Cabinet of Ministers met in an emergency session on Friday morning to discuss the unfolding developments. Prime Minister Honorable Alan Chasney has activated the National Emergency Management Advisory Committee, NEMAC, and a special meeting was held yesterday, Friday afternoon. Lisa Joseph, you prepared that report following live yesterday from the Finance Administrative Center.
Yeah, so let's take a look at that report and we'll chit-chat after. Prime Minister Honorable Alan Chasney told the NEMAC meeting that at this time, the country will not be shut down, nor will curfew be imposed. Rather, strict enforcement of established protocols by the Royal St. Lucia Police Force will be in effect as the Ministry of Health manages what is now community spread of COVID-19. Chief Medical Officer Dr. Sharon Belmar George says a contact tracing app will be introduced to aid in the fight. All schools island-wide will remain closed for 1 week, and the Castries Comprehensive Secondary School closed for 2 weeks. During this period, the Ministry of Health and Wellness will continue to conduct its necessary screenings, the results of which will help determine the way forward. The ministry says instruction will revert to the multifaceted approach of online learning and safe distribution of instructional packages from teachers during the period students are at home.
We are presently at 500 persons. The decision to reduce mass crowd activities to limit it to 100 as we monitor and manage the situation on the ground. All sectors with the phased reopening of the economy presented plans, COVID-19 safety plans to allow the safe reopening of their organizations. We noted over the last few weeks a level of complacency and non-adherence to those. There'll be strict enforcement of protocols from community markets to nightclubs to dances to beach parties to weddings, funerals, church activities. And boat rides will be limited to family excursions only, taking out the public boat rides, which pose a risk to us. So all of those activities will be strictly enforced per protocols or run the risk of losing their licensing or being closed within very short measures. Also, we're coming close to the Journée Créole activities. Those will be limited to family home activities, and the community activities will not be allowed.
Health Minister Senator Mary Isaac called on everyone to play their part in keeping the country safe.
When you're in a community and you see a person who's supposed to be in Martinique or supposed to be somewhere else and the person just show up, you need to be able to report that to the authorities. You have to, we all have to do what is necessary for us to contain this virus. It may well be our own lives that we are saving.
Prime Minister Alan Chasney stressed that this is not the time for panic, but collective action.
The only way we can protect ourselves is by being each other's brother's keeper. It's the only way. And we have to have zero tolerance. We were getting away with it because for the most part, we didn't have it in our communities. We now know we have it in our communities. And that's why I'm saying to you, we don't need to wait until tomorrow or next week to find out what the numbers are. The remedy is the same. Persons who are currently infected, can't change that. We need to try to help them find out that they are infected, get them to quarantine as quickly as possible, but the rest of us need to be safe practices. And I assure you, there's a study that came out today that said if you're in a plane and everybody's wearing their face mask, even if there are individuals who have COVID on that plane, you minimize the likelihood of you becoming affected by wearing your mask.
The Chief Medical Officer says it is anticipated and expected that St. Lucia would have to manage small waves of COVID-19 without going through extreme measures. From the Government Information Service, Lisa Joseph reporting.
And no sooner did that meeting happen, the live broadcast that you and Primus had, Lisa.
Yes.
We heard of another case coming out of, what is now looking like a string, another case of COVID-19.
I think what's important, and that came through at the NEMAC meeting, is for everyone to understand what page we all on, and for there to be a harmonization, an agreement, commitment of all the various sectors. And as I said, you had a representative of the sectors there, and others joined via the Zoom platform. So it was a very healthy discussion in the closed session. I know that St. Lucians did not get to see the closed session. Also, I don't think we can question the commitment of our professionals, whether it be the Ministry of Health, whether it be from the police force, whether it be the fire service, and all other professionals involved, and experts and specialists involved in St. Lucia's national fight against COVID. The Prime Minister, as I indicated at the top of the show, was very, very firm in asking for the cooperation of all St. Lucians. I don't think at any time he was passionate, indeed. I think some people are perceiving that sort of impassioned plea to be almost as if a draconian tone was being set. And the Prime Minister was also very clear in indicating that that is not the case. It is not a case where anyone, the state wants to strong arm anybody into adhering to the protocols. But because this is such a serious matter, and because, yes, it is life-changing, because lives are literally at stake, I don't think that we, as citizens, as individuals, and as responsible persons, that we should even question being able to play our small part in saving our own lives. And so that national effort is exceedingly important if we are to be making any sort of dent and headway into staving off a serious wave of COVID-19. And as the CMO indicated, never did she, and I think if we go back, we go back to the very beginning, the CMO has always been very careful and always very clear that St. Lucia is not a case that we will never have community spread of COVID-19. The question will always be how much of it there will be and how we'll be able to manage. So when she yesterday said it very succinctly, that we will always have, or we should anticipate and expect, small waves. And those numbers now will determine what happens moving forward. Now, as she indicated, on Monday, the cabinet will be meeting, and quite intently to discuss whatever happens or whatever those test results are coming out of the efforts happening this weekend. And so by Monday, there'll be a very clear picture as to what are we going to do. And we can't even say for the short, medium, or long term. The question is, it's really responding where we are at the time because of the fluidity, that fluid nature of the situation, because perhaps we can plan to take one route on Monday, and by Tuesday morning, things have changed drastically, for better or worse. So we never really know exactly what it is that we are planning for, but again, that's where we leave it to the experts for them to be able to guide us, better guide us on how we should be able to do things.
Absolutely. And, just to go back to your point about the Honorable Prime Minister, you look at a child who perhaps became sick and has slowly been recovering. Imagine your countenance when you see perhaps that your child may not be doing as well or is reverting to a previous, state. Definitely concerning. We were placed in a very enviable position by the gains we made with regard to the pandemic. The fact that we had been able to control, the pandemic, having low cases, no deaths in St. Lucia. And the concern, the reality. If we look at other countries whose health systems have collapsed, who are trying very desperately to have some sort of economic, survival at this point in time.
And that is the thing, and that is where it lies. Because even if you are strictly focused on healthcare and shoring up the healthcare, boosting up the system, making sure that you have everything, that takes money. And if the country has no money coming in, the government is not able to have revenue, where does that leave you as a nation? So COVID-19, this is really, it's crippling on both fronts. And you can't not pay attention to the economic aspects of the situation. Because if you do not have the economics, the funding, the finances not there, you cannot protect lives. It's really as simple as that. And so we now have this precarious duty there of being able to balance taking care of the healthcare system and being able to take care of the livelihoods, because you need the livelihoods in order for the healthcare system to be operating.
Yeah, an equation that definitely we know the government officials are trying hard to work out to ensure the health and safety of the population and ensuring that the economy is doing okay. Again, it boils down to us as a population, the common man, going about his business, ensuring that they play their part, you know, and I think we should look at it, Lisa, you know, the same fevered pitch that, you know, championships take, you know, in terms of competitions. You know, there was a joke on social media that, you know, we didn't beat in cricket, we didn't beat Trinidad, but at least we were beating COVID, you know, and at this point in time, we need to look at it like that, you know, how can everyone play their part? We must all be team players on the field to ensure that we can hit that goal every time in mitigating the risk.
And you're right, and I think too that we shouldn't be despondent, we shouldn't be discouraged as a nation. And so you're right, this is the time that we have to have this can-do mentality and have it together in this one spirit that we can make it happen. So we shouldn't feel like we are losing the battle with COVID. No, we're not losing. And so if we now double and triple up our efforts, we can indeed stave off any very steep increase in numbers. We really can. Now, on the related, let's get to something quite exciting, and we spoke about it earlier, the rapid antigen test, which can transform the Caribbean's fight with the COVID-19. We want to go now to a clip of the Dr. Carissa Etienne, who is the Executive Director for the Pan American Health Organization, PAHO, and she talks a bit about this antigen test.
Thanks to the tireless work of the WHO's ACT Accelerator, we now have an affordable and reliable diagnostic test that can be performed anywhere. By providing results quickly, the new test empowers frontline health workers to better manage cases by isolating patients to prevent further spread and to begin treatment immediately. And it gives healthcare workers, whether they're working in a hospital in Buenos Aires or a mobile health clinic in the Amazon, it gives them the power to test and diagnose cases within minutes, not days, at 1/3 of the cost of the traditional PCR tests that we have been using. These new diagnostics will allow us to test more people faster and more accurately than ever before, particularly in remote communities without easy access to a laboratory, which have been disproportionately impacted by the pandemic. If distributed widely, this new test will transform our COVID response. Today, PAHO has in its possession hundreds of thousands of these tests, and we have those available via the PAHO Strategic Supply Fund, with millions more expected in the coming weeks. So we have built up a stockpile, and we are able also to access those tests for our member states.
And that's the director there of PAHO, Dr. Carissa Etienne. And, you know, she spoke about having these tests and making it available to the member states, St. Lucia included, as you just heard the CMO indicate. So for PAHO, there's a strategic supply fund, and it is a regional technical cooperation mechanism for pooled procurement of essential medicines and supplies, and it's a central component of PAHO's strategy to move towards universal health for all of its member states. So a picture as what's happening to us in the Americas, with North America, Central America, and Latin America, or South America. So we have more than 18 million COVID cases and more than 590,000 deaths have been reported. And the state of the pandemic in the Americas remains very complex. That's Dr. NTN giving an update there. And she says that Canada is facing a second wave. Cases in Argentina continue to accelerate. The Caribbean is seeing a high number of cases. And in many countries, the pandemic has also moved to less populated areas. So the PCR diagnostic tests, which are highly accurate and must be conducted in lab settings, remain the gold standard for testing. But delays in getting results mean that people run the risk of infecting others while they await their results. And so we can see that this is happening across the board because you simply do not have the space that's for every single person that you have to test, that you can put this individual in a state facility, a state quarantine.
And even in larger countries, you take your test and you ask, even when you're confirmed with COVID-19, you're asked to go back home.
To stay home, to stay home. Yes, self-isolate. And so that remains. So that sort of PCR gold standard testing is now available with this rapid test, this antigen rapid test. And so we are hoping that this, as the director is indicating, going to be a sort of game changer for us here in the Caribbean when it comes to testing and diagnosis for COVID-19.
We continue for the morning with the update coming from the Ministry of Health and Wellness on dengue here in St. Lucia. We're also confronted with an outbreak of dengue fever here on island, and St. Lucia, we got the confirmation yesterday, has recorded 2 more dengue-related deaths. And the ministry was investigating these 2 dengue-related deaths earlier this week. Both individuals had been seen and managed at the Owen King EU Hospital. They presented a clinical picture that is consistent with dengue fever. All the samples were tested locally for dengue virus and were sent to to CARPHA, that is the Caribbean Public Health Agency, for confirmation. We did receive confirmation. The Ministry of Health and Wellness received confirmation, and this now brings our total number of dengue-related deaths to 3. We go to a clip now from Dr. Michel Fossoir, the national epidemiologist, just urging the public to pay close attention to the signs and symptoms of dengue fever.
In its mild form, dengue fever may present with fever, headache, pain behind the eyes, muscle and joint pains, and a red, itchy rash. There are several warning signs that persons need to be aware of. These include intense and continuous abdominal pain, persistent vomiting, which means 3 or more episodes in 1 hour or 4 episodes in 6 hours, bleeding from the gums or nose, bleeding in the urine or in the vomit or dark-colored stool, restlessness or drowsiness, as well as enlarged liver. Persons presenting with these warning signs should immediately seek medical attention. Approximately 5% of persons progress to a severe form of dengue infection. There is no specific treatment for dengue fever, and management is supportive based on presenting signs and symptoms.
So as of October 3rd, we've not gotten an update yet. As of October 3rd, a total of 540 confirmed cases have been recorded. The mean, okay, we have an update. As of October 10th, 2020, a total of 711 confirmed cases have been recorded. So as of October 10th, 711 confirmed cases of dengue in St. Lucia have been recorded. The mean age of cases is 21 years. The age range is babies as young as 3 weeks old to as old as 84 years old here in St. Lucia. So please take note of that. Go around your home, ensure that you don't have any receptacles that are collecting water. We had some rain earlier this week, and we know for the proliferation, for the life cycle of the mosquito, the vector is heavily reliant on stagnant water, fresh stagnant water for their life cycle. So please take note of this important update. We have a second clip from Dr. Michelle Fassois, just speaking to us, giving us a visual on the cases, the hospitalization rate of the dengue cases here on island.
But before we go to her, we can just say that we would be happy to interact with you, and you can give us a call here at 468-2162. We'll be very happy. You could call. You can ask any question, maybe something that we can clarify for you, information that we could try to access for you and give it to you as immediately as possible. So, and if you just want to make a comment, that's fine. So you could buzz in, and we'll be very happy to interact with you. You could also post a comment or question on the Facebook platform, and we'll be happy to address that as well. So let's go on to Dr. Michelle Fassois.
Although all health regions have reported cases of dengue fever, the highest prevalence continues to be reported in the northern part of the island, with Castries, Gros-Islet, and Babonneau accounting for 34%, 17%, and 8% of cases respectively. In the south, Vieux Fort accounts for 14% of cases, followed by Dennery with 10% and Micoud with 6%. Among the northern settlements, Castries, Bexar, and Babonneau have confirmed the most cases, while in the south, Dennery Village and Vieux Fort Town confirmed the most cases. The public is reminded that both dengue serotypes 2 and 3 are in circulation. The likelihood of persons presenting with severe form of dengue is therefore increased.
The public is being asked to assist in the control of dengue fever by eliminating breeding sites in and around their homes. And this can be done by discarding of all open containers with stagnant water in and around your home on a regular basis, using insect repellent, which may be applied directly to the skin, clothing or mosquito nets, wearing long sleeve shirts and long pants, especially during the hours of highest mosquito activity. Now, if you do have any sensitivities, you have allergic reactions to certain chemicals, you can go to the pharmacy at the supermarket and ask them what you can use for yourself. If you have a baby, maybe they have a specific insect repellent that you know you can apply to your baby and on the mosquito nets and on your clothing as well. I was just telling Lisa, that somebody told me that they saw, larvae. They had their dish rack, the drying rack in their kitchen. When they looked under where the water collects, they saw mosquito larvae. So, it's just a cause to be as vigilant as the COVID situation for dengue, looking around your home to see what ways. It's not just the receptacles around your home, but just the unusual things around your home and in your home as well that may be accommodating these vectors.
Well, Jesse, I did an interview with the environmental health department, officers from the department, and they were making a point that even within your toothbrush holder, because water depends, right? So water can get in there, just perhaps the toothbrush and just drip, 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 and it's in there.
And you're none the wiser.
And you're none the wiser. None the wiser, and there you have a breeding ground, and so it will be important now, and I'm doing that now. So every time I reach for to make sure I'm even wiping on the inside to make sure it's dry before placing it back into the medicine cabinet. So these things can be very tedious, time-consuming. You try to remember, then you get mad at yourself for not remembering and that sort of thing. But it's just to try to be consistent. I mean, wow, I'm going to say it, life is hard. On top of everything else, we have to really, it's a lot to police yourself. So can you imagine what the police officers are going through? Because they need to police themselves, their families, and then they have to come to you.
Even persons in the health service, they need to maintain discipline and the hours, strenuous service are being offered to the public. So it's important that we too do our part. on every front.
Okay, I have some information coming out here now from the Ministry of Education. Okay, so listen as intently as you can. I'm going to try to speak as clearly as I can as the mask would allow. So the press release now coming in, it says, ahead of the reopening of schools on September 7, 2020, the Ministry of Education, in consultation with the Ministry of Health and other stakeholders, put together a comprehensive guideline for the safe reopening of schools. The Department of Education, in consultation with the Department of Health, will continue to strengthen and enforce those guidelines and protocols. These recommended measures include various modes of operation for teaching and learning in keeping with the need for physical distancing and limiting the number of persons on the school compound at any given time. Sanitization, personal hygiene, and personal protection have always been and will continue to be a priority among the recommended measures. In fact, under the two main teaching learning modules at schools, one day is set aside for deep cleaning and sanitization. In some instances, that day is every Friday, while in other cases, it is every 7th day. Additionally, there is the daily cleaning of the workplaces and facilities. In light of the recent COVID cases, it became necessary to engage in further general deep cleaning and sanitization of all schools as per established protocol. On Friday, 16 October, a multi-stakeholder workshop was held at the NSDC to address protocols and to fine-tune education continuity plans. The following are some of the measures communicated by the Department of Education to schools and other stakeholders ahead of the reopening of schools in September, that is using soap, water, and disinfectant. Janitorial staff is required to clean and sanitize all rooms, the floors, corridors, high-touch areas, and other areas of schools to be used by staff and students daily. Janitorial staff must properly clean and sanitize desks, chairs, workstations, tools, equipment, classrooms, labs, workshops, specialist rooms, and facilities used by staff and students daily. All workspaces, laboratories, specialist rooms, and classrooms must be properly ventilated. Janitorial staff must wear disposable gloves and protective gear. All persons on the school compound must wear face masks at all times. All staff and students must practice frequent and proper hand washing with soap and water. Paper towels must be used to dry hands and must be properly disposed of in bins. Contents of bins must be properly disposed of by the janitorial staff, and those bins must be disinfected. Hand sanitizers or hand gels must be used in cases where it is not possible to wash hands with soap and water. Staff and students should practice physical distancing and avoid direct contact. There will be frequent sanitization of books, apparatus, and other learning materials used by teachers or students and other persons as appropriate or as needed. Persons must cover their mouths and noses and cough into the elbow or tissue. All staff and students are required to maintain good hand and respiratory hygiene before, during, and after travel between school and home. All students or staff with any of the symptoms of COVID-19, that is fever, dry cough, sore throat, shortness of breath, loss of sense of smell or taste, must stay home, contact a medical doctor, a medical facility, or call the hotline 311 and explain your situation. Staff and parents of students must inform the principal about any illness. The guidance from the health authorities must be followed on what to do when someone in the household is sick and self-isolating. Parents of any students in need of counseling or psychosocial support may reach out for assistance by emailing joycelyn.eugene, that is JOYCELYN.Eugene at education.gov.lc, or you can call the hotline, that is 311. Staff in need of psychosocial support may make use of the counseling services provided by the government. There is that program, the EAP, I think that's what it's called. We would like to reiterate that these guidelines have been in effect since the opening of school on the 7th of September. These guidelines and other protocols governing the early childhood education sector and special education centers are being reviewed and fine-tuned in light of recent developments. So that's the information coming out. I know it was pretty lengthy, coming out there from the Ministry of Education. And Jesse, you can see that there is such detail to the protocols at the schools in terms of what we don't see as the public, what happens, how the school is being tended to, the facility, the plant, the desk, the chairs, whatever it is. And so if we are to follow what's in here, you can see that we're not saying that there will be no transmission, but certainly the risk is minimized adhering to this. So perhaps as we close later on, we will go through some of the more important parts of that release again.
Absolutely. And the number you can call this morning in a while is 468-2162. Call in to make a contribution. What is your resolve at this point in time based on the latest cases that have been recorded, the word from the Chief Medical Officer? How do you feel about the NEMAC meeting that was held yesterday, the bits of it that we were able to hear thanks to the live broadcast hosted by Primus and Lucia yesterday? So you can call in and let us know how you feel. If you have any queries, we may be able to direct you in the right area, the right personnel for assistance at this point in time. Schools remain closed for 2 weeks. The Castries Comprehensive Secondary School remains closed for 2 weeks. All other schools closed for 1 week. And it has really hit home, guys. It has hit home. We have seen that investigations are being conducted at a secondary school, at an institution at this point in time. The public transport, the minibus operators have had to be tested this past week. We really need to be very careful. You know, I've heard a couple times when I'm in town, in the public domain, COVID, tiwesa,
and that sort of thing.
Yeah, I've heard it, and it's real now. We need to do our
It's not
part.
a drill. We have a comment here online, and an individual wants to say, so are we still saying that the bus driver is the one who gave it to those persons? Isn't it possible if he contracted it, they couldn't have been the ones to transmit it?
No one has indicated the index. No one has indicated the source. But there has, as the Chief Medical Officer did indicate, there has been a connection made between case number 30 and 31
and case number 29. And I think too that the CMO never said that he gave it to these individuals. What she said is that there is a link, and that link can mean many things. Certainly, if you're doing your tracing, it could be that someone who may have traveled on the bus and who could have come into contact with someone else, that the couple knows. The couple came into contact with that, or just one of whether it be the husband or the wife, come into contact with that individual and then going home. And so I think that sometimes there isn't a clear enough understanding of how transmission takes place. And so if you now have to go back and trace all of these individuals, you will see, again, there is a link. Not saying that it is the driver who needed to cough on someone directly. And so, no, that's not what it is. And so every individual who would have come into contact thereafter creates that link. That is what you are tracing all the way back. And so, again, which is why it would have been very useful for us to be able to trace all the way back to that index. Where did the bus driver himself get infected, a possible source of transmission for him, because that now really gives you more evidence in order for you to go out into particular areas that may not be of your focus right now.
Yes.
And so there could be cases festering in some other part of the island that we're not aware of, all because you do not have that ability to trace all the way back to where that possible original source of transmission was. So,
you know, just to help persons better understand, you are definitely linked to your great-grandmother, but it does not mean that she gave birth to you.
Absolutely
So there
not.
are persons in between that may be connected in this whole tracing situation between the index, the first case, the source of these cases that we're so far seeing, and the latest case. So please take note, we're not stating that the minibus operator is the origin of these latest cases that we're seeing, or vice versa. We're just saying that there is a link.
And we do know that he was plying the route symptomatic.
Yes.
So we do know that.
Yes, that was confirmed by the chief medical officer, that he was symptomatic.
So he had those symptoms and signs of COVID-19, and he was still plying the route. So we need to make that. Somebody's asking about quarantine. I know the quarantine has been a very hotly debated thing, and the individual wants to know that if he or she has no money, if coming back home, what would happen? Do you know?
Well, certainly at this point in time, we did hear that the Prime Minister did indicate that there would be some intervention and special arrangements being made for individuals who have found themselves in dire straits. We do understand, and I think the government of St. Lucia is sensitive to that reality. But if we look at globally, you know, traveling worldwide is a risk unto yourself, you know, and persons are traveling right now. Persons are paying top dollar everywhere. You know, you want to travel for business, you want to travel for pleasure. They're paying top dollar, whether it is to pay for their COVID-19 test, the PCR test. They're doing whatever they can. But here in St. Lucia, the government of St. Lucia is sensitive to that reality and trying to ensure, just coming up with ways to accommodate these individuals who are cash-strapped, who are trying to just come back home. We did see early on where at a point in time, a period where, you know, St. Lucians were not being charged for repatriation, and the quarantine period, that other countries were charging their nationals to come back home and to be quarantined. So there has been extensive graces being afforded to nationals returning to St. Lucia, and it continues up until now, where the government of St. Lucia, even while stating that, you know, after a certain period of time, you will have to pay for your stay, there are still graces being afforded to persons in dire straits.
Yes, and so we know that students, for example, at least 3 months after a study coming back home, they will be exempt from that. People going to seek in medical care outside of St. Lucia, they're also exempt from the cost of state quarantine. And home quarantine, yes, home quarantine is the ideal thing, as the CMO consistently says.
Constitutional.
It would be ideal if we could have everybody stay home and allow themselves, you know, to go through that period and so forth. Unfortunately, people are not adhering to what they're being told. And so now the state is forced to be able to really do for you what you wouldn't do for yourself. And that's where the cost factor really does come in. So, you know, as much as possible, given what the situation is, we all have to be able to manage. And I think to Jesse, around the world, as is evident with what's happening with the airline industry, people are really questioning whether they should be traveling. And if I am going to travel, can I really afford the excess cost? Because testing is happening worldwide, so you need to be able to pay, not just for that plane ticket and your accommodation, but you now need to pay for testing when you need to travel to the place, and testing when you're coming back out. So, you know, it is a hard place to be in, but unfortunately, it is what the situation dictates.
Absolutely. Well, we've run out of time, Lisa. I don't know if you could, any calls on the line? If anybody wants to call in, we're giving you the next 2 minutes or so to call in to make a contribution, 468-2162. The number you can call is 468-2162. Meantime, just to go over the lead stories that we saw for this week, we saw case number 33 emerging last night, confirmed by health officials. And we so far had 5 new cases just recently, and we do hope everybody's playing their part to ensure that they are in adherence to the protocols protecting the population from COVID. The NEMAC meeting held yesterday, new outcomes coming out of that in terms of increasing, the zero tolerance policy and the increasing heightened surveillance. We have a call. Hi, good day.
How are you?
Good, thank you.
Is this Dawn Marie? It's Dawn. Dawn Marie, how are you doing?
I am doing well, thank you. I am doing well. I just wanted to say that it's very nice to see you guys back on Saturday. If you miss Coach, I must tell you that. But
we are working on getting him here. Next Saturday, the gang will be back.
oh, great. Okay. There's Cynthia on here. So I just wanted to say to everybody, please, it's being so politicized here in the States and there now. It has to stop because, even myself, I'm in a few groups and I'm being attacked, and it's okay because you know what, I can handle it. But I really feel that the CMO or the Prime Minister, or even you two ladies, I don't know, have to be the ones that have to give the information. It cannot come from an administrator of a group because they're going to accuse, so to speak, the rally, or they're going to say that it was the bus driver, or they're going to say that it was a supposed hotel worker. Everybody is now in a panic. I have many friends that are hotel workers that are supposed to go back soon that they don't know if they should or not. It's just, I don't know about that word fear-mongering. I don't really even understand it, but we just can't keep putting fear in people, and we can't keep attacking each other because it's not good. It's not good for your mental state, it's not good for your physical state, and it's certainly not good for the country. It really is not. You're a small country. I used to think you were a loving country. I don't know what's happened. I really, really don't. And maybe it is because of the elections, but I just wish that everybody listening could just stop and just let the CMO say what she has to say, whether you believe her or not. I don't know. I can't imagine that anybody would jeopardize their degree, their job, but whatever. That's on everybody else. But please just, you know what, New York fought it. We fought it well. We see a few outbreaks, a few clusters because of, I hate to say it, religious organizations that believe that they're above the law, that don't want to wear their masks. So those areas have closed down. But thankfully, we're doing well as New Yorkers. I don't know what's happening around the other states. We have 30-something states that can't come into New York without a 14-day quarantine. You don't want that. You don't want that. You can't afford that. The United States maybe can afford that. I don't know. I don't really know. But please, all I just want to say is I'm happy to see you guys back. I think that this program goes a long way. I'm watching. There's 222 comments. There are a lot of people watching. Just let's keep spreading positivity if we can, please. That's all. I miss you guys.
Thank you so much, Dawn Marie. It was great to hear you, and she always brings a fresh perspective, that outsider, because as you just indicated, Jesse, New York City, you can't enter the state of New York without having to do 14-day quarantine. Imagine that. Just imagine that. Anyone coming out of it. So New Jersey, which is, right, you can't come in if you don't do a 14-day quarantine.
Yeah, and she did make the point that the CMO has also indicated to ensure that wherever you go for your information, if you are concerned, if you're worried, that you ensure that these, whatever sites that you go to, whatever channels that you tune into are official, and they're providing word or press releases from official sources. Please ensure that. Well, we have expired our time.
I know we have. I just want to thank you, Miguel, for the thank you, Miguel, for this extra minute. We didn't get a chance to go to the Lucia MOU with the government, with the electricity assistance program, just to make mention of it, because it is such a critical intervention. We know that we have the thousands of people who are out of work right now. In many households, both parents are out of work. And so you now have this assistance where there's up to a $75 credit, I believe, every month that is given on the electricity bill. The government is absorbing the cost of that. So we have in the range of up to 6,000 individuals or households who will be benefiting from this agreement with Lucia. I note that there was a question about how are people being selected. The Ministry of Equity is the one spearheading this initiative, and that welfare department there, we've heard the permanent secretary, even at the opening, the signing ceremony, indicate that the needs that are coming in are so rapidly increasing. So the ministry does have a criteria, and we will get to perhaps next time or during the week be able to funnel out exactly how it's working. But certainly the people who are already on existing programs, so they have the vulnerable groups, whether it be persons living with HIV. You also have the disability, the people on the disability grant and the public assistance program. So these individuals also will form part of that. And then, of course, you are going to assess people who are coming in. So is someone out of work? What is the level of income that they have outside of a formal employment, and so forth, in order to give that form of assistance?
We're just going to go to the clip from the Honorable Prime Minister that was during the signing held on Thursday, I believe, or Wednesday afternoon. The signing by the Prime Minister and Minister for Finance, Honorable Alan Shastney, saying that the electricity assistance program was designed to add value to the lives of those who have been most affected by COVID-19, as you rightly mentioned, Lucia.
The initiative offers assistance to groups of persons we believe are extremely vulnerable and in need of extension of support by the government. The program offers a credit to participants that is in line with the average monthly consumption of low-income households. Persons who meet the criteria and have decided to opt into the program will receive the nominal credits on their September 2020 to February 2021 electricity bills. These credits would be applied by Lucia and paid for by the government of St. Lucia. We anticipate that approximately 5,000 to 6,000 St. Lucians will benefit under this program. The government has embarked upon a broad-based consultation over the past 6 to 8 months and has worked closely with public sector agencies, private sector entities, civil society, not-for-profit organizations, and statutory bodies to develop various strategies and interventions. One such organization is the St. Lucia Electricity Services Limited. We are very pleased today to participate in this signing ceremony, which is symbolic of our partnering with the Electricity Company Services to make this intervention possible.
That was the Honorable Prime Minister, Honorable Alan Shastney, speaking there on the electricity assistance program. Again, if you want to be part of it, if you're going through a tough time right now, you can make contact with the Ministry of Equity to find out how you can benefit.
And Jesse, it was very instructive to hear the Managing Director of Lucia, Mr. Trevor Louisi, indicate that discussions on this have been going on from June. And that gives you an idea that, as members of the public, we simply think that because we probably throw out a suggestion that it can happen, as we say, just so.
Overnight.
It doesn't happen overnight.
And just to mark that, Lucia has been quiet, prior to now. Very quiet, and we're now seeing that there was work happening.
Work is happening.
Conferencing with the government of St. Lucia to try to work something out for the people.
And I think too often, of course, we are impatient as members of the public.
And we equate silence with inactivity.
Exactly. And this was a very good example as to no, the administration, and that includes all other agencies, national entities, and so forth. Work is being done. It's just a matter of time. And as Jesse said, it doesn't mean that because you have institutions are silent that nothing is happening and no one cares about the plight of individuals. But unfortunately, these things do take time. even, and we've heard coming out of the Ministry of Finance, even discussions with the World Bank, the IMF, and even if a press release comes out and it says X amount of money has been given to so and so and so, it simply means that there has been, in principle, an initial agreement, and so they're making it known that this is going to happen, but the actual transfer of funds can happen months later after the initial announcement. And so, yes, you know, exercising just patience sometimes can really bear through and let us know that something is happening.
Absolutely. Well, we have come to the end of our week in review, live on NTN today, Saturday, the 17th of October, 2020. St. Lucia has confirmed its 33rd case of COVID-19. I believe we have 5 active cases right now here in St. Lucia, persons being treated at the Victoria Respiratory Hospital. We do hope that while the investigations are ongoing and contact tracing activities happening, that you play your part to protect yourself and your family. Use the masks. We're harping on it, but it is important. Use your mask if you're going out, hand sanitizer, copious amounts of it, hand washing with soap and water, observing the 6-foot distance. I mean, when I go back upstairs, I'm going to put, you know, a sign, you know, at my desk, 6-foot distance, you know, because at this time things are getting real. We need to all ensure and protect ourselves. If you have kids, your family, your elders, your grandparents, you love them, protect them, play your part. Melissa?
All right. And thank you so much. That's all left for me to say. Thank you so much for being with us. And just to let you know that we will from now be here every Saturday. And we'll be very happy to bring you all of the information that we can. If you want us to be able to find out some information for you, you can do so. You can actually email. If you can email Ask Me Anything NTN at did I get it right?
At gmail.com.
Gmail.com, that's what it is? Okay, good. And we'll be happy to get that information for you. So if throughout the week you want something done, feel free, email us, and we will be very happy to meet your demands.
Oh, we're not giving our number because we're not a hotline. The hotline
is 311. Yes, that's the hotline.
As we close, we just want to close with this news report. Ancillary is one of 3 pilot communities for village tourism here in St. Lucia, scheduled to undergo upgrades of the waterfront and front streets in that village. The upgrade forms part of the village tourism community infrastructure improvement component. A check presentation of funds for the initiative was held in the village on Thursday, 15th October 2020. I'm Jessie Leonce on behalf of LISA. We'd like to thank you so much for watching. Do stay tuned for more NTN programming, but least of all, stay and watch this report on the village tourism construction beginning next week. Take a look. Goodbye. Financing for the first village tourism hotel on the island has been secured. This project will form part of the transformation of Ancillary, backed by the Republic of China, Taiwan, to the tune of US $1,865,671 under the Bilateral Cooperation Agreement grant for 2020. Taiwanese Ambassador, His Excellency Peter Shen, handed over a check for the sum to Tourism Minister and Parliamentary Representative for the area, Honorable Dominic Fede, during a ceremony held at the waterfront of the fishing village on Thursday, 15th October 2020.
Ancillary will have the opportunity to host the first village tourism hotel right in the location where the police station building is. That's component number 1 of the project. There will be 10 bedrooms, and we will put this building up to tender to any resident who would like to run this facility as a small business. The rental fees goes to the village council, and so there's an opportunity for anybody in Ancillary who can come up with a brilliant business proposal to run that facility as your very own business. This will no doubt create several jobs for the community. It will bring about a tremendous economic spin-off. Our shops, our bars, our restaurants are going to be better patronized by our international clientele.
Other components of Ancillary's transformation consist of village square redevelopment, rehabilitation of the fish fry building, and a new restaurant to be constructed at the site of the old community center on the waterfront.
The Ministry of Infrastructure, they have rendered this building structurally unsound. And because the structure is compromised, they have actually recommended it for demolition. And so by next week, we should be rolling in with the excavator and other equipment to demolish this building and let the transformation of a great restaurant begin. And on the waterfront here, another business opportunity for another business person in ancillary to come and to put a business proposal forward to the Village Council, working with the Ministry of Tourism, the Ancillary Development Foundation, and we will together determine who has the best ideas to run a proper restaurant facility on the waterfront.
Speaking in his capacity and on behalf of the Prime Minister, Honorable Alan Chasney, Honorable Guy Joseph expressed thanks to Taiwan for backing the transformation of Ancillary.
I must take the opportunity to say special thanks to the government and people of the Republic of China, Taiwan, for such a generous contribution in these difficult times. Further, when we came into government, we sat with the Taiwanese embassy and we said, while we love the T-Canal projects and we love the footpaths and we love the concrete roads, we also want projects that would be revenue generating, that would be job creating, not just in the short term, but in the long term for the people of St. Lucia. And they readily accepted.
Ancillary is one of 3 communities on island receiving attention under the Village Tourism Project. Permanent Secretary in the Ministry of Tourism, Donald Invite, says work to upgrade Ancillary, Soufrière and Grosselet are part of efforts to refine St. Lucia's tourism product, pending full recovery of global tourism.
Village Tourism Initiative is a vehicle that the government will use to build local inclusion. Too long we have been hearing from community residents that it's expats who own accommodation properties. We want to ensure that you too get your piece of the pie. We want you to become self-sufficient. We want you to assist us in improving the linkages. We need to use the downtime that we have right now because of COVID to get ready so that when the doors finally burst open, we will have our fair, graceful and stately position to announce that St. Lucia is prepared, that Ancillary is prepared.
The transformation projects for Ancillary are scheduled for completion in February 2021.
Thank you.
For the Government Information Service, I am Jessie Leonce reporting.